Welcome to the meningitis final report, where having a real headache is serious. So our patient background and symptoms. This patient is a 76-year-old female who has recently traveled to Southeast Asia for 3 months. In this pandemic, her symptoms are experienced headache, fever, and vomiting for the past week. The cerebrospinal fluid results tells us that there are high counts of leukocytes, which means that the body is fighting off an infection. There's low amounts of glucose, which means there's a bacteria consuming glucose as its energy. And there's high amounts of protein than normal, which means there is a leakage from the blood to the fluid. This is a list of 7 bacterial species that can cause meningitis. So here are our staining results. For gram stain, it helps determine whether the bacteria is gram positive or gram negative. But for the stain in this picture, we can see it's both pinkish and purplish color, which tells us maybe it doesn't have a gram. For our endospore stain, it shows only red, which means that it doesn't have any vegetative cells. Otherwise, there would be some green spots around the area. So now for our acid-fast stain, our results show that it's pinkish instead of bluish. So this indicates that it's positive for mycolic acid. And for our blood agar plate, a differential plate, it shows that the bacteria is clearly growing here, but no hemolysis is occurring. Hemolysis is when blood breaks down, so we can rule out some bacterial infections. So right now we can just check that it's possibly Mycobacterium tuberculosis because of the mycolic acid being present in our results. And we could eliminate the possibilities for it to be Streptococcus pneumonia and Streptococcus agalactiae because no hemolysis occurred within our results. Moving on to the chocolate agar, we can see there are tons of microbes, streaks and colonies of them growing. So this could indicate to us that our bacteria is non-fastidious. Otherwise, this amount doesn't make sense. Now, McConkey's agar is a selective media that grows non-fastidious gram-negative bacteria. And since there are no signs of living life forms visible, we could eliminate the possibility of it being E. coli. Now for Thayer-Martin agar plate. We know it's very selective and it grows the pathogen of Neisseria. And there's no growth, so we can eliminate Neisseria as a possibility. For eosin methylene blue agar, it's a differential media and inhibits the growth of most gram-positive bacteria. And since there is nothing growing, so we eliminated most of it besides Mycobacterium tuberculosis and Listeria monocytogenes. But we remember from the acid stain that mycolic acid is present. Therefore, our conclusion is this. So, the final diagnosis of meningitis is due to the bacteria Mycobacterium tuberculosis. The treatment plan will be a combination of antibiotics for the first 2 months. This prevents any chance of the bacteria to become drug resistant. And then a pair of antibiotics will be given for 10 months in order to be certain that this bacteria doesn't come back. Any family member that has been in close contact with the patient is to be tested, treated, and vaccinated. The prognosis is that since this was caught within a week, the outlook of the patient's health is promising.